or and so probably a very different type of presentation than we're hearing this morning, but or afternoon. My name, as you know.
Do you have any internet issue? Your voice is just breaking down. Do you have any internet issue? Your voice is breaking.
I don't know if I have any issues. It doesn't appear to be on my end.
Okay, now you can go ahead. Now it's clear.
Okay. Hopefully the connection. Leadership development and organization development for a very long time. So my expertise is not in medicine. It is in helping organizations be better, helping leaders be better, and helping everyone work better together. So the research that I undertook really helped to address the problem of preparing positions. And so I looked profession negatively influence their psychological contracts towards becoming a manager, which would obviously impede recruitment and preparation of clinical managers. So some of the key elements of this research, as you can imagine, would be the act of advancing a member of an organization to a higher level in the organizational management hierarchy. So in this case, from a staff nurse into a management role. The other piece of this is psychological contracts. And so a psychological contract includes an employee's personal expectations that their work creates an obligation from the organization to reciprocate. And so this is in the mind work that they provide. The next piece of this is social identity. And so this is the part of a person's self-perception that originates from their membership of a social group and the emotional significance that being in that group will bring. And then lastly is just nurses, as I think we're all familiar with this. So these were employees care, and these were in New England. And so revolved around interviews being conducted around acute care staff nurses in New England, the New England part of the United States. The research question number one was, what are acute care staff nurses' perceptions of their social identity? I asked them, why did you become a nurse? To the profession or to the organization? And to get to more of the psychological contract element, it was, what types of personal or professional development do you seek? What types of jobs might you seek throughout your career? And most importantly, what do you expect from your employer in return for your work? So to get to the summary of this, obviously a lot of coding and analyzing had to take place. But when it came to social identity, the findings really said that nurses' identity is comprised largely of their membership of a team of nurses, but more as an individual caregiver, and that nursing was the most frequent response to participant loyalty. That can be immediately applicable or connected to their current job. In other words, they really wanted clinical development, not management or leadership development. So respondents did not generally anticipate assuming a nursing management position, except for the 2 male nurses in my study. The explicit expectations that nurses have on their employer most frequently included the pay and benefits, and really didn't include anything about management or going into management. The second research question was really, how does acute care nurses' social identity affect psychological contract formation toward a career in management? And to get to that, we asked them several questions, or I asked them several questions. Can you be a nurse but not provide patient care? Do you expect to be promoted? What would you seek? Would you seek a management position? Why or why not? Do you think being a manager would change you? And if so, how? What types of personal or professional development do you seek? What types of jobs might you seek throughout your career? What do you expect from your employer in return for your work? And so through an analysis process of all these questions through these interviews, we're able to get to some additional findings for the research question number 2, which was provide care, which means their orientation was more about care and not necessarily towards loss of social identity with nurses. The majority of nurses did not expect to be promoted. Majority of nurses would not consider nursing management. No indication of social group betrayal or loss of their nursing comrades or their social identity as to nurses if they became a manager. Only one respondent feared a loss of team membership, and stress was the most frequent reason to avoid management. So the original intent of this study was investigate how nurses' social identities shape their psychological contracts towards promotion into management. So to break this down, the social identity piece of this, we found that nurses and less comprised of being a part of a social group of nurses. Pay and benefits in exchange for their hard work, and did not mention promotion. And then lastly, promotion into management. Participants did not expect to prepare for a formal management role, but focused on clinical development instead. So to summarize all of this, the results show that nurses' social identity, their membership of a nursing social group does not significantly affect psychological contract formation toward a career in management. Instead, nurses' individual identity more of a barrier for the stress and concern with the management role formed their resistance. As with any study, there are some limitations. The biggest couple with mine are the geographic location. So it was done in one acute care facility in New England. And then the sample size. So the sample size was very small. It was only 11. However, there are a number of recommendations that we can draw from this research. So firstly, upper management can do some things regarding talking to nurses about their expectations, shadow staff nurses to show support and listen to their concerns about their career, address the stress and fear of assuming a manager promote multiple identities. So empower and structure nursing management roles to continue caregiving, even periodically. Help nurse managers shift their care compassionate towards their employees, and promote multiple identities instead of viewing nursing as an either or. Professional development. Balancing management development with clinical specialty education. Nurses should be able to obtain an education that prepares for management responsibility, and proactively and consistently choose nurse managers by their potential to manage and lead, because sometimes we promote nurses based on their clinical skills, not because of their ability to manage and lead. Recommendations continue. So restructure management role and pathways. So identify a more clear path towards advanced preparation of their management role. Clinical nurse managers appear too far removed from the bedside. Associate compassion and empathy with management, and create nursing management curriculum at undergraduate level. Communicate the importance. So fear and stress can be the result of management communication. Staff nurses get negative feedback from managers about their position, including stress, lack of power, and unrealistic expectations. So these nurse managers may be too so we have to manage how we're communicating about associated with assuming a management role, which is what I found in answer any questions. I know we're behind on time anyway, so I'm glad I was able to go fairly quickly.
There is any question from the floor?
Well, I must say something. This is, it will be interesting if you take this research to different countries, because what we see in Saudi Arabia is that this young people are getting out of university. Remember, they're different from different countries, and the trainings are different. They come out of university, don't even have experience in nursing, and they all want to go in management posts. First thing, for the hours and to keep the cup of coffee in their hands and sit in the office. And if I train them and teach them regarding management, I tell them, you need to know about your patients. You need to know about your staff. You can't just manage and you're 22 years old. I'm a nurse for 37 years old. And I was, for the last 15 years, I was a manager. I'm not actually interested because I love training and teaching much better. But it's amazing what you said now, that in your group, they don't really, their goal is not to be a manager. But where I come from here, they all want to be managers. And it's amazing.
Thank you so much for sharing that. I love the international perspective on it. And I think there's a lot of opportunity for future research around this and how we can create pathways. But it sounds like that's not quite an issue in where you're from. So thank you for sharing that.
We can just laugh, that's all, because management is not always easy.
Management is not easy, and it takes a lot of, the more proactive we can be about building those skills, the better off I think we will be.
Anybody more who wants to add something or say